Welcome back. It is exactly 12:41. I have two amazing ladies in studio with me, and they are Raeesah Waja, Director of Sanca Nishtara Drug and Alcohol Center based in Lenasia, and of course the therapist that has joined, and that is you, Joshna Lutchman. We're going to be talking drug awareness. It is Drug Awareness Month, and just what a scourge it is on our communities and society at large. What we can do about it, how we identify it. Can we actually overcome this war against drugs? Can we truly rehabilitate our loved ones? So all of that and more is going to be answered by Raeesah Waja, and of course, the therapist, and that's you, Joshna Lutchman. But let's go for an ad break first, and we'll be joining you in a couple of minutes' time to tackle this very serious, uncomfortable, and daunting task or topic, and that, of course, is Drug Awareness Month.
Breaking stereotypes, moving boundaries, joining hands. Salam Media. Humanity sets the agenda.
Peace and solidarity. Join us for the annual Soweto Walk for Gaza, taking place on Saturday, the 20th of June at 7:30 a.m. The walk will begin at the historic Regina Mundi Church and proceed to the monumentous Lamini Mosque, bringing together people of all faiths, backgrounds, and communities in a powerful show of unity and support. Bring your family, friends, and fellow residents as we walk together for a common cause. Let your voice be heard and your presence counted. That's the annual Soweto Walk for Gaza, Saturday, the 20th of June at 7:30 in the morning, starting at Regina Mundi Church and ending at Lamini Mosque. Together we walk, together we stand, together we show solidarity.
It's a new beginning. It's a new era. Salam Media, humanitarian journalism.
Discover the Africa of your dreams and surround yourself with her spectacular beauty. Relax beneath her serene sunsets and explore wildlife at its natural best. It's where the pride of Africa comes together. The Kwantu Private Game Reserve. Get to know the Big Five or cruise on an elephant safari game drive. Interact with lion and tiger cubs and enjoy world-class halal cuisine while we pamper you during your 5-star stay. Indulge in the true African experience. For reservations, call now on 042-203-1400 or visit kwantu.co.za. The Kwantu Private Game Reserve, the place of gathering.
Gaza needs your support more than ever. Homes have been shattered and families have lost everything. With your support, our teams are delivering clean water tankers, feeding the hungry, and assisting orphans who have no one left. Let us give Gaza whatever help we can. African Muslims Agency, empowering, educating, inspiring.
World-class financial services only at Sapphire Global, your financial partner. If you are looking for Islamic, Sharia, and ethical financial products, look no further. Sapphire Global offers a wide range of financial service offerings from short-term to life and investments. A full-service center with all financial requirements under one brand. Our highly skilled and experienced consultants are ready to help protect your financial future. Contact us on 041 001 0184 or visit our website on www.sapphireglobalfs.com. Sapphire Global is an authorized financial services provider.
Connect and stay ahead with Salam Media. This is Salam Media, coming to you live from South Africa.
It is exactly 12:46, our final interview of the morning, and we're going to be talking with Raeesah Waja and the therapist at Nishtara, Sanca Nishtara Drug and Alcohol Center based in Lenasia. The therapist is Joshna Lutchman. And we're talking Drug Awareness Month. We're going to look at issues around recovery and hope with both these amazing ladies. So, Assalamu alaikum to you and
Walaikum
good
salam.
afternoon. Welcome. Thank you indeed. Drug Awareness Month. Dark issue indeed. Dark because we know that families who have addicted loved ones have a life of chaos, of drama, of possibly helplessness. So let me start with you, Raeesah Waja. You are now the director of Sanca Nishtara based in Lenasia. You've been in this position for a couple of months, and I kind of have to ask you the question, why have you taken on this position?
Thank you so much, Julie. Yes, I'm in my position for 60 days. And one of the most important things that I ask myself is, why do I want to do this? And I performed my Hajj in 2023.
Subhanallah.
And that's when I actually had this significant change, and I wanted to give back in terms of into the community. And this opportunity came. So when people ask me, why am I here? I always say, Allah put me in this particular position. But in this job, sitting behind my desk, I've met the individuals that I see that I want to help. And when we have individuals and patients going through our treatment process at Nishtara, you see them coming in totally broken. You see these individuals, you see families that are broken, that are worried, that are going through significant issues psychologically, physically. And after our 42-day program, they literally have a smile on their face. They have this optimism that we are going to recover. And even though recovery is such a long process thereafter, that hope is there. And that's the reason why, that fulfillment that I get in terms of helping a family member, helping the family in terms of dealing with drug abuse, alcohol abuse, or basically any addiction. That's what Nishtara is there for. We handle all types of addiction.
And to you then, Joshna Lutchman, you are a therapist. You have indicated to me off air that you've been in this space for 30 odd years, but 4 years with Sanca Nishtara. Why do you do it?
I think very much in terms of the fact that there is hope. And I do believe strongly that people can move from a point of destruction to something more useful. The other thing that I also pick up with the reason why I do this work is that if you can make a difference to one life, and I said to you earlier on, one addict has a direct effect on at least 17 to 20 people directly. And if you change one perspective or one aspect of that life, you're changing 20 lives in the process. And you can see the ripple effect thereof when you're working with the families, when you're working with the individual. And like Mrs. Waja says, when they come in, they almost even look physically drained out. They look completely shattered. And when they leave our program, right, sometimes we even have a good laugh and a chuckle at them because they've gained weight, they've gained complexion, mindset is clearer, attitude is different, the excitement to want to live life is back.
So it is Drug Awareness Month. We often hear that addiction is a disease, a brain disease. We also understand that it's a lifelong disease. So for the recovering addict, after they've been in your center for 42 days, clearly that's not enough time to kick the habit. So what else happens after the 42 days? Would you like to respond?
Absolutely. And Joshna can come in as well. So our program, what's unique about Nishtara is we have a program that incorporates the family as well as the individual that's going through the addiction. After they leave our premises for 42 days, they sign on for a contract in terms of aftercare work, where it comes in with group therapy, individual therapy, and we see families on a weekly basis over that period of time. And that's where we hold their hands. So we have individuals in our aftercare group that's with us over a period of going into 10 years. And recovery is a journey. It is not something that happens, within a period of time. You've got to hold hands. You need the support of both the family and within the therapy group at Nishtara. This is what we then provide.
So, Joshna, in your time at Nishtara, what are some of the very common misconceptions people have about addiction, and how does this affect people who are trying to seek help?
I think a lot of people, when they come in initially, don't see it as a disease, firstly. The second thing also, what I also notice is that people don't accept that they have a disease. And often people feel that, for example, if I stay clean for maybe a week or two, I can do this on my own. And what they come to realize is that they do need the support, they do need the help, and they do need the interventions and the program that we offer, because that helps them to shift a lifestyle.
Absolutely. Earlier on, we were talking about warning signs, symptoms, when to catch it, how alert should parents be regarding their children, their growing children. And I also put the question to you then that in many instances, the addict is so far down gone by the time they come to your facility, to Nishtara, for assistance. What are we doing wrong that we don't pick this up in the early stages of addiction? And I should imagine if we do pick it up early on enough, we can nip it in the bud. Am I being too simplistic?
I don't think so, but I believe that families, when you look at a particular problem, we almost go into this ostrich syndrome, put your head in the ground, believe that the problem will go away. So we know there's a stigma in our society. We don't talk to our kids. We rather believe that, everything's okay. I don't believe I'm seeing it. He's changing, but, maybe it's not true. And I think if we have that open communication, that would change. Recently, I've seen a study that Sanca did with UNISA that's going to be published shortly. But one of the key things where they asked the youth, why do you turn to drugs? And the most important thing that came up, which surprised me, is number one on that list was, we have money. So are we as parents providing, financial support for this habit without realizing? We've provided everything at home. They've got everything, every comfort. And what else? Where do they get their next fix? This generation is one that wants instant gratification.
Absolutely.
So where do they get a gratification from? And many of them are turning to alcohol. Many of them are turning to drugs. So I'm not saying that it's the parents' fault, but what I'm saying is we are close to it if we start realizing the symptoms. And the symptoms are clear. Your child will be operating, acting differently. There may be physical changes, loss of weight, tremors, where a child is an introvert, becomes an extrovert. And I keep on saying children, but truly the reality is this happens across the board. We're having young adults, we're even having, middle-aged individuals that's going into drug addiction and alcoholism in terms of any age. So we say addiction does not discriminate. It can happen regardless of your age, where you are, your background, your economic status. It basically touches everybody. But it means that we need to understand and we need to break that stigma about keeping this a secret.
Joshna, what about nipping it in the bud? So if a parent picks up at a very early age, 15, 14, 12 years old, and, realize that the child is experimenting, that's still at the experimental stages, is it possible to nip it in the bud? What sort of intervention or treatment plan do you introduce at that early stage of addiction?
Okay, that's a nice question you're asking. So it's touching in with what Mrs. Waja said. It's about having an open communication firstly. So to encourage parents and caregivers to have open communication with their children, we need to learn to identify, like you're saying, the signs. It's there. Right? When it's been noticed, access resources. Nishtara is one of those resources that can be accessed. We do have a program that we've worked with in the schools, where the schools are aware of our services. So if the school teachers or if anybody at school picks up that something's not okay with this child, or they pick up smoking or child's behavior, they refer to Nishtara, and then they come in and they get assessed and they get tested. And say, for example, should they test positive for any substance, and often it's dagga, what happens? They immediately then contracted to be part of a program which we facilitate with the youth, right? Now, considering schools, times we're unable to work during the school hours with them, so we have a program running on a Friday afternoon where we have them in. Part of the program is education, accessing resources, teaching them about skills on how to say no, how to work with their life circumstances, empowering children so that they don't make the wrong choices. So that's one of the programs that we do run. And we seem to be having a steady increase, and we have that increase during a certain period of time. So obviously when it's school holidays, we're very quiet because the schools don't pick it up. As soon as schools reopen and as soon as they start picking it up, and that's how we get the referrals coming through.
And sadly, during the holidays is when they get up to mischief.
Exactly.
That's the time when they want to experiment. They want to show off, amongst their friends. They want to brag. And whatever it is that goes on in a teenager's mind. And sadly, that's when they get hooked.
That's true.
Not?
Absolutely. Peer pressure plays a significant part of drug addiction as well. But we need to equip our youth to understand when to say no. I've got kids as well, and Joshna's got kids. When we look at our children, drugs is readily available, universities, schools, at the local park, at the local shopping center. But how do they then realize I could have an addictive nature? Because when you're doing it, you go in and you want to experiment, but thereafter it could actually grabs you to a position that it affects brain function. It affects you so significantly that you have no idea how to help yourself to actually come out of this difficult program.
You talked about having an addictive nature, and that's a very important aspect. You have a family of maybe 3 or 4 children. The 3 are great, perform well at school, typical A students, etc., go on and make something of their lives. And you have the one child that is a dropout, just doesn't do well at school, and is just a handful, just a very difficult person to interact with, and they just kind of fall by the wayside. So what do we understand by this addictive personality? And does that also indicate that all addicts have a mental health issue? Because clearly it has to be linked, because I don't think any rational person would want to self-harm in that way. Your thoughts, Joshna?
Okay, I think you're raising something in therapeutically. If we look at it, right, it comes back to developing our self-esteem and our self-confidence. And when that is lacking, we find that wounding or that gap in, I always call it the wounding of the soul, right? When that something is missing, then most of the people that come through the process, we've discovered, is that they're trying to fill that gap, right? So even addiction is almost like a bandage on something that's deeper. And often it's got to do with our sense of self, our sense of worth, our confidence. And often that is related to how we've been brought up, our resources, our connectivity. Are we able to connect? Have we not been able to connect? So it comes back to those kind of basics.
Clearly, there is a mental health issue here
Definitely.
as well. Self-esteem. I kind of also wonder, I've heard from time to time that if the person has been perhaps abused as a child, and that's pretty sensitive. And I'm wondering about families watching us this morning and having to ask themselves those difficult questions about, what did I miss in my child's developing years? Whilst I was at work or busy with life, was someone abusing my child? And is that the reason why my child has turned to drugs? How do you deal with that, Joshna? And do you, in your therapy, try and go back to the root cause of why you decided to start drugging?
Yes, I think that's one of the ways of working in therapy, because you can work on tools, you can work on skills on how to say no. But if the root cause is not being understood and dealt with, it can reoccur. it can reoccur. So therapy is, when we're doing therapeutic work with regards to recovery, we do have to go back into where did it start from. And like I said, often it comes back to something in the growing up times that might have gone wrong, or might have not been there, or might have been neglected. Or maybe somebody was rejected, or somebody was being abused, like you're saying, and not being able to share that information, or not coping with that correctly, or how it was dealt with also has impact. And
Is it ever too late to help people with all of those issues?
no,
There's
no,
always hope.
There's always hope.
So let's come back to you, Director of Sanca Nishtara Drug and Alcohol Center, Raeesah Waja. What is the type of a program you offering at Nishtara? You know, we hear about all the different programs, the 12 steps, and that's just one of those. And the different tools that you then give to the recoveries.
Okay.
What is what is it that you offer?
So with Nishtara, we offer, firstly, let me start from the beginning. If you find that you know somebody or your family member has got an addiction, the first point of call is to give us a call at Nishtara. Well, can I give our telephone number now or later? It's 854-5988, 854-5988. Once you've called us, we will then book you in for an assessment. When the patient comes in, we'd like to refer to them as the patient. When the patient comes in, we will then do a drug test in terms of determining what specific substances this individual is addicted to. We then do a very intensive assessment. Out of that assessment, we will now determine what sort of treatment would that person require. Would the person need an inpatient treatment or an outpatient treatment? An inpatient treatment means you stay at our facility. We, like I said earlier on, we run a 42-day treatment where you stay in. So we provide 3 meals a day. You get snacks, physical training, you get group therapy, individual therapy. We have a Salah facility on the property as well. So you're getting a holistic treatment.
But you do cater for all religious groups.
All religion. This is
Okay.
absolutely open right across. We have patients coming from all over Gauteng, even from other provinces, even internationally from across the border, from Africa. So we help everyone. There is no specific denomination. And absolutely open. So with the inpatient, you stay there for 42 days, and thereafter you enter the aftercare therapy. Our outpatient treatment also works on a very similar, where you have the 6 weeks program. We go through group therapy, family therapy, and you work with us through the aftercare program in that space. We offer awareness and prevention campaigns with government. In terms of a program called Kimoja, we do a lot of school visits. We work very closely with corporates in terms of doing wellness training, helping you to identify. So even if companies have got problems, we can come out. We can do talks with them. We'd love to, this becomes part of our revenue. We would like to, charge you in order for us to then be able to do what we can do to help patients. But those are the type of programs that we then run as well. We also have a detoxification program. So with the detoxification program, when the individual comes in, we manage that individual over a period of approximately 2 weeks. And sometimes that would require, with the help of a doctor or our psychiatrist that's that's with us, in terms of helping the patient then to recover over that difficult period.
Let's talk costs, because a lot of families find rehab centers, and I'm not talking Nishtara, I'm talking private rehab centers. They do charge high rates, and it's unaffordable to a lot of families. And sadly, that's the reason why certain families are unable to get the help they need for their loved ones. So in terms of costs?
Right. So Nishtara is a private facility, but we do have subsidized patients. So we work very closely with the Department of Social Development. One of the key things is we are a registered facility. So many of the other rehabilitation centers out there, although our purpose is the same, which is to help somebody that's suffering with addiction, the difference here is we are registered. So we work with a very structured program within structured outcomes for the patient. So in terms of it, we offer subsidization for certain individuals. We do accept medical aids, and then obviously a private patient facility as well. My recommendation is give us a call. We can see where we can help you. We don't like turning people away. So give us a call. Let us discuss it. Your family member that's suffering with an addiction comes first.
Okay, let's go psychological now with you,
Mhm.
Joshna. Issues around, and we're hearing that the drugs these days are more toxic. Even Daha, for example, is mixed with other toxins, resulting in a lot of the patients becoming psychotic. What do you do in situations like that? And would Nishtara turn away those patients, or do they need to be hospitalized, taken away from your facility and be hospitalized?
Okay, so yes, drugs do cause the psychotic behavior, and it does cause mental health issues, right? So for that very reason, we also have a on-board psychiatrist and the doctor. So they first check in before admission. On admission, they are being seen by the doctors. With the psychiatrist, we often work quite closely in terms of treatment. So we work hand in hand. We monitor, and we have nurses 24/7 on the premises, and we have a clinical nurse as well. So they're quite geared up and glued up on it as to what to look out for. If it's unmanageable, if it's a risk to the person's well-being and life, then of course we can't keep them on the premises because it's a risk then to other patients. So then we would request for the family to take them in, be hospitalized, be treated, and then return. It's not a dismissal from the facility or the services. It's actually first treat what is necessary and then come back, and then we can work with the rest of it.
So how many patients does your facility accommodate at any given time?
We can accommodate 26 patients at a time. And yeah, we open in terms of, because of the 6 weeks program, we work on a process of when we can accommodate we can actually rotate the patients all the time. And remember, because we have an outpatient facility as well, that becomes another element where we see patients on the outside of from an inpatient side. So we then can see patients at a time when it's convenient for them, and then going through a 6-week structured program.
Okay, so the 6-week structured program for someone who can afford to attend, how much does that cost? But you are also saying that if you are having difficulties raising the finances, please give us a call. We will be able to try and work something around in assisting you. But what is the cost?
So we subsidized by government to approximately 17,000 Rand per patient. And the cost currently is about 35,000 Rand, but we're flexible. So we don't, at many a times we get donations to cover certain patients. And that's the reason why I don't want to stress the cost of a patient that comes in. And where I say we are completely flexible of how we can manage this going forward, or with anyone that is in difficulty.
Okay, just wanted a ballpark figure to put out there.
So when you're looking at treatment across the rehabilitation space, goes between 35 to 42,000 Rand per patient to actually look at a patient and to make sure that the patient goes through a 42-day program.
Absolutely. And you've got to take into account, I mean, you're housing the person 3 meals a day, snacks, comfortable bedding, comfortable accommodation, plus the professionals there, psychiatrists, doctor, nurses, therapists. So yes, it all comes at a cost. We're going to wrap up now. Is there anything at all, let me start with you, Joshna, that we want to put out there regarding Drug Awareness Month and your facility, which of course is the Nishtara, Sanca Nishtara Drug and Alcohol Facility?
Okay, what I would really, really like to say to people out there, if you know of someone that needs it or you yourself need it, do not hesitate. Take the help, whether it be with, and Nishtara is available. Nishtara is open. Take the help. Take the first step. It takes a lot of courage because addiction breaks and recovery reconnects. Okay, beautiful. So we need to remind ourselves that human beings need connection.
Absolutely.
And healthy connections.
Thank you. Closing remarks from you.
Nobody wakes up choosing to become an addict.
Wow.
And we there to prove that recovery is possible. So please contact Sanca Nishtara. Our number again, 854-5988. And we'll be happy and we look forward to helping you recover and reclaim and restore your life.
Subhanallah. Raeesah Waja, Director of Sanca Nishtara Drug and Alcohol Center based in Lenasia, and therapist Joshna Lutchman, who's been with them for the past 4 years. Thank you so much for coming in. God bless both of you.
Thank you.
May you be rewarded for the amazing work you're doing together with your teams, and continue reclaiming and resaving lives, inshallah.
Jazakallah khair.
Thank you very much.
Assalamu alaikum.
Walaikum
And
salam.
that's where we leave it 10 after 1 o'clock. Thank you for being with me on the show. Take care till you and I get together again next Monday morning at 8 o'clock on News and Views. Assalamu alaikum and Khuda Hafiz.
Soweto, it's time to stand together for justice, peace, and solidarity. Join us for the annual Soweto Walk for Gaza, taking place on Saturday, the 20th of June at 7:30 a.m. The walk will begin at the historic Regina Mundi Church and proceed to the monumentous Lamini Mosque, bringing together people of all faiths, backgrounds, and communities in a powerful show of unity and support. Bring your family, friends, and fellow residents as we walk together for a common cause. Let your voice be heard and your presence counted. That's the annual Soweto Walk for Gaza, Saturday, the 20th of June at 7:30 in the morning, starting at Regina Mundi Church and ending at Lamini Mosque. Together we walk, together we stand, together we show solidarity.